Alive and Well STL is a presentation of the St. Louis Regional Health Commission and Rare Gem Productions to build a healthier St. Louis. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and Managing Director of the Ferguson Commission. Today we wrap up our series focus from the Alive and Well STL Ambassadors Open House. With a tremendous turnout and incredible feedback, we're ready to move forward with this initiative, and more importantly, move forward with you.
Any insight you want to leave listeners with based on your aha moment as you connected all these dots?
I think for me the aha moment was that it doesn't take massive infusions of money. It doesn't take a whole lot of giant education. It takes thinking of a kaleidoscope. You remember how those look. When you just make one little click and you change how you look at things, everything changes. So if we just change how we look at it, we can make a whole lot of difference.
We'll be right back.
I think what's important for all of us to remember is that we need to find out what has happened to people. So instead of what's wrong with that boy, what's wrong with that girl, what's wrong with that mom, it's what happened to that boy, what happened to that girl, what happened to that mom, what happened to that community. There is a story behind everything that occurs and every behavior. And what we need to do in terms of getting to Alive and Well is be willing to ask the question about, I want to hear your story. Tell me your story.
Alive and Well STL. You were invited to the table as an ambassador. Take a listen to this fourth case study and continue to lend your ears and attention to where we are in our community, how we might look at this familiar scenario, and what things you know we should consider as we attempt to address these issues.
Case study scenario number 4, 51-year-old man. A 51-year-old man arrives in the emergency department with chest pain for the 4th time in 2 months. He was recently laid off from his job. He lives alone and has battled alcoholism much of his life. The first time he visited the emergency department, he was diagnosed with a heart attack. One of his arteries was blocked, which the hospital fixed by implanting a stent to improve blood flow. This is his 3rd emergency department visit since the surgery. So far, the doctors haven't found any new blockage or new physical findings. Without insurance, the medical bills continue to pile up with no answers about the recurring chest pain.
Come on in for the sake of the future of our community.
Amy, share a little bit about the scenario that you were presented with this morning.
So we talked about the gentleman who presented at a hospital with heart problems, and they couldn't find anything wrong with him, and he had previous stuff wrong with him, but then also had some alcohol and substance abuse problems with it, and what were some kind of the assumptions and things that even working affiliated with a hospital setting that we had talked about, those immediate, one thing that I said currently might be happening is those judgments, and those previous if he wouldn't be having this alcohol problem, then how would that contribute to, if he would just stop drinking, then he wouldn't be having all these problems, or, another frequent flyer ER visitor, and that kind of judgment and things that currently happen now. We were also looking at, the checklist, that lovely checklist, and saying, where's the insurance? If not insurance, let's get a Medicaid, instead of looking at the bigger picture of, well, what's going on with this person to help them stop coming here? Because it's not just the heart thing, which led into the trauma-informed discussion of how do we look at people holistically, how do we train very busy staff doctors and nurses to have that piece of education going in of how do we look at the better well-being, because, the stressors might be what causing the heart stuff, and the alcohol use versus just the reverses, which is what the judgments were. So.
That's a rich discussion. So what was your contribution as to how to assist in that case?
Currently, even talking about, pulling nurses and doctors and training and stuff is very hard to do. You can't pull them offline very often. So contributing to that conversation about huddles and grand rounds and huddles, already grabbing them when they're together and giving that 10-minute, 20-minute in-service of, here's what behavioral health or here's what trauma can do, just impact of trauma. Because in residency and training and nursing, they don't get that piece in the education piece. So you're going into a field where you're exposed to it at 120%, but you have no training to deal with it. So we can't pull you offline, but here's where I can meet you in the middle and give you just enough to take with you, to go forward.
Great food for thought. Amy, thank you for joining us this morning and for being an ambassador. See you soon. So, Virginia, there are 4 case studies going on in this space. What's your insight from the discussions that you're hearing and seeing?
I had a real sense at the 4th one that really they were all connected and potentially all the same person's story. The first story involved a young person who was getting trouble at school, and you could see that the possibility for intervening there wasn't happening. The kid would be thrown out of school or have really difficulties and not stay attached to school, who then maybe becomes in a gang or is one of the kids who was involved in the shooting later in life that we learned about. That person then ends up in prison, who is the third story that we see, where now the individual's in prison and is trapped in that system, and the systems that we have that may keep him from, I'm assuming it's a him, maybe it's not a him, but assuming that person then can't get maybe a housing subsidy because they had a criminal background. At each step along the way, we could change the gate. We could do a healthy intervention, or we could let the system grind along as it is grinding along. And then you end up with the final gentleman, who may have been somebody who witnessed the shooting and who carries that trauma, who then has heart attacks and who then drinks. So we create this system of spirals that are going downward when we could create the system spirals going upward.
Absolutely so. Yeah. So we had many times to intervene to change the narrative. Any insight you want to leave listeners with based on your aha moment as you connected all these dots?
I think for me the aha moment was that it doesn't take massive infusions of money. It doesn't take a whole lot of giant education. It takes thinking of a kaleidoscope. You remember how those look. When you just make one little click and you change how you look at things, everything changes. So if we just change how we look at it, we can make a whole lot of difference.
Thank you for joining. Appreciate
you.
Your insights and sharing them with us. Ambassador Virginia.
Thank you.
All right. Good morning, Jennifer.
Good morning.
In what way were you part of today's team?
The one session that I helped facilitate was about a man who has heart disease and keeps coming back to the ER with chest pain, and the doctors can't find anything physically wrong with him. We know from the case study that he does have a history of alcoholism, lost his job, and lives alone. And so in that, I can identify people I know in that. I can identify people I know who have suffered violence in their own communities, and kids that really have a hard time with school because of everything else that's happening in their lives. So I think it's pretty easy to identify with these things and to kind of get in the space and walk in the shoes of those people. You just have to take a minute to think about it. And think about not just the obvious things we know, like a man that keeps going to the ER, but the fact that he's alone. Our group talked a lot about what happens when you're alone and you don't have support around you and you live in isolation. And the fact that maybe the ER is comforting and you don't really even know that going into that, but you feel like people in there are there to help you and care about you. And if you don't feel like that in your daily life, then that might be the best option for you.
Are there any other insights from community members who came and joined in the discussion you could share with us?
One was that we can have a big impact in a setting like an emergency room by just changing body language.
Okay.
With staff just having a different demeanor with the patients as they come in, and to perhaps ask some different questions. That it doesn't have to be a complete transformation. There are things that we can do down the road that are transformative, but we can start today. There's nothing that keeps us from starting today.
And we can't control our facial expressions, the questions that we ask. We can control ourselves before the system begins to catch up with the issues.
Right.
Thank you, Jen.
Thanks.
Yeah, not only does trauma and toxic stress affect us physically, it affects the choices we make, and it affects the opportunities that we have. For example, a man my age, if I grew up in Spanish Lake, the opportunities and choices I would have as a child and as an adult would be much different from where I did grow up in Afton and Sunset Hills. So when we look at issues of trauma, we need to keep in mind that communities under stress and under constant trauma, the choices and opportunities differ.
Alive and Well, STL. Now let's equip ourselves with the tools and information we can share with family, friends, and colleagues about how they can become alive and well. We are excited about this opportunity. This exciting information was shared with our participants and volunteers from our Alive and Well Ambassador Open House. We bring it to you, our listeners, to be a part and engage as well. All are welcome to attend. Listen closely for more of the Alive and Well STL Ambassadors Initiative.
We are grateful for your gift of time to this conversation. We encourage you to stay involved and get involved.
If you, your family, or your organization is interested in talking about how we better the well-being of the region, sign up for more information, join the conversation, log on to aliveandwellstl.com, and let's build a plan on how we can work together and improve our overall health and become alive and well. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of Rare Gem Productions. Thanks for listening.